You have to ask yourself, tests are Russian. What is an efficient way to allocate tests? From a public health point of view, you want to tell the people who have it you are actually positive so that they self-isolate. You also want that the people who are positive and will get sick, which is not the majority of the people, to come to the hospital earlier. So another logical thing is to say maybe a good way to allocate tests is by incidence, meaning by the share of people in the population who have it. Everyone would love to know what is the incidence of coronavirus in the population. We would love to know, is it true that, say, the bottom 10% of the population are more infected with coronavirus than the top 10%? To know this, we would really need to have random testing because there are a lot of selection issues. Getting a test is difficult. And so how do you get selected into having a test? Maybe you don't want to go and have a test. You say, I need to go to work. I'm not feeling that bad. I really need to make that money. I don't go. Or the hospital in your neighborhood puts the implicit cost of getting a test very high by saying you need a queue for 4 hours. So we don't know incidence, but we can use our data to at least put some bounds on incidence. Suppose it was true that conditional on you having the coronavirus, your chance of being tested is independent of income. So if you have coronavirus, the chance that you get tested is the same for a rich and a poor person. Then our data can be interpreted as saying that the incidence in the population of the bottom 10% was 50% higher than the incidence of the top 10% of the population. And then if we go back to your question, who should be tested, and if testing should be proportional to incidence, we would say that the bottom 10% should have been tested at a much higher rate. They should have given 50% more of the tests than the top 10%.